I was an anesthesiologist for 25 years, and with 2 years of the 25 still to go until retirement, I went to rabbinical school. In my 5th year of rabbinical school, I did an internship at Valley Beth Shalom. During that year, I gave a couple of drashot and led services in the library minyan. After ordination as a rabbi, I remained active in the library minyan. About 2 years ago, I became the library minyan president. A few months ago, I learned that once a physician, you were always a physician, and once a rabbi, you were always a rabbi. Like most of you, in February and March of this year, I learned the horrors of the coronavirus pandemic engulfing the world. In March, New York was hit hard by the virus, and announcements were made for retired physicians to go help treat infected people. I gave serious consideration to going back east to help. As an anesthesiologist, I knew I would be where the sickest patients were, in the intensive care unit, intubating patients. I knew of the dangers involved. I'm 71 years old and healthy, but I knew that in managing the airways of those patients, I would be putting myself at high risk of contracting the coronavirus myself. It was a very difficult decision. I had spent 25 years taking care of patients with difficult airways, and now I was really needed again. I saw reports on TV of surgeons and anesthesiologists who died caring for patients with coronavirus. It was a really difficult decision. About the same time, I heard that because of the virus, VBS would not be holding services in the sanctuaries. Most of you know this drill already. We were supposed to be 6 feet apart from each other to keep the viral infections down. We were also to be wearing masks. The library minyan had been meeting twice a month in the library at the end of the hall on the 2nd floor of VBS. It is a smallish room, and the chairs were very close to each other. This was not suitable for social distancing. I called Rabbi Feinstein and asked if I could do weekly library minyan Shabbat services on Zoom. He said, "Go for it." I thought I would do a service or two and then head back to New York. But the pandemic was only getting worse, and the death rate was only going up. I didn't think I would like doing Zoom services, but I really did like it. Previously, at the library minyan services, I mostly stood in front of the room and davened prayers with my back to the congregation. Now I was facing my congregants with their face pictures on my computer screen. It was great. It was cozy. I quickly got to know my congregants in a way I never had. I developed a deeper sense of spirituality toward them. I was surprised these people were showing up on my computer screen at 10 a.m. every Shabbat morning. I've learned how much you can say to people with a smile and just a few words. This is chesed. There was fear on the faces of my congregants because of the corona pandemic. But I am still a physician, so I reassured them in some ways about the virus. I have about 20 to 25 people a week on Zoom. I love it. It's wonderful. I have made new friends. I feel like I really have a congregation now. One of the hardest things that you have to do as a physician is to realize you as a person are not solely responsible for every patient there is. And even though I feel I could have helped save lives if I had gone back east to New York, there are other capable physicians who did the same work I would have done. Our Zoom Shabbat services usually last until about noon. Besides the Torah and companionship, I think we all feel the biggest thing we are missing is the library minyan lunch spread we were used to twice a month after the services at VBS. I hope we get back there to VBS soon.